I have no COI for this presentation. There are some patients who continue to complain of pain and discomfort around only the urethral meatus, especially who are affected GSM and BPS, even though main symptoms almost completely cured after this treatment. On the other hand, the area of the urethral meatus and vaginal anterior garden are receiving blood supplies different from other vaginal area, and the androgen receptor are more rich than the estrogen receptor estimated by embryology. We try the treatment of testosterone cream for pain and discomfort around the urethral meatus after treatment of GSM or BPS. GSM patients were given local estrogen therapy, and BPS patients were given antidepressant and pregabalin already. We prospectively studied 26 patients, mean age is 66. The number of GSM is 18. The number of BPS is 8. Patients used the 1% testosterone cream for directly the area of the urethral meatus and vaginal garden, anterior garden, 0.1 gram per every 2 days or 0.05 gram per every day for 1 month. This is the result. We used the pain scale for judging the efficacy of this treatment and judged effective for the patient who recovered their symptoms over 60% after treatment. The success rate of this treatment was 73%. This is fairer cases. Lichen sclerosis is 1, BPS is 2, GSM is 1, clitoris pain is 1, and stopped by side effect is 2%. Sexually active women were only 19%. The 2 of 5 patients restarted their coitus. The main side effects are acne, headache, hyperphagia of the nipple and clitoris early in the administration. There are no characteristic side effects which are genital bleeding, hoarseness, clitoris hypertrophy in this time. Average level of free testosterone was from 0.7 to 1.8 between before and after treatment. They are estimated normal level. Local testosterone therapy is estimated to effective for pain and discomfort around the urethral meatus after treatment, GSM and BPS. Thank you for attention.
Thank you. Interesting concept. Any questions from the floor before you're there? Do you think this is mainly a peripheral effect or a central effect? Because it's known that testosterone can have an impact on midbrain centers involved in emotional control. So they could have a central effect on the pain, or do you think it is rather a local effect?
I think in this study, local effective is almost only local effective.
But there must be a central effect because you have side effects elsewhere in the body. So the testosterone reach also the brain. You show that the serum levels are quite high with this therapy. So it must have a central effect also. And I won't say that the disappearance of pain is related to central effects, but I would estimate that there is an important role.
But there are no side effects for central nerve. which is, for example,
It would be interesting to check what it does on the HAD score, hospital anxiety and depression score, if there is no significant change in that respect, which would be an indication of a central effect rather than a peripheral effect, I think. But that's, Dick, you have the floor.
Hi, I have a question. You have, because there's a lot of referred pain also to the meatus due to BPS or other pain syndromes. Have you distinguished your population between local inflammation around the meatus and perhaps a more neurological referred type of pain? Because that might really influence your results, I think, in this whole very heterogeneous cohort. You understand? So if it's local inflammation around the meatus that does the trick, or is it more referred pain coming from somewhere else? And did you distinguish that between your patients?
Only around only pain and discomfort around the urethral meatus only.
But you did do a vaginal examination in these patients, you said. So you should sort of check if they have inflammation locally around the meatus, or if it's completely normal, and if there's maybe a difference between the patient groups in this. That would be quite relevant, in my opinion. But
in these patients, there were no indication of other places in the vaginal or the genital area or the vaginal garden, as you say it so eloquently, that show signs of inflammation. It's purely inflammation at the level of the meatus in these patients. No other signs of inflammation.
I think significant DSM patient have around urethral meatus. It is good. It is good and sign.
Yeah, I think we need a vaginal gardener to further examine that. If there are no other questions, then we conclude this session. I thank my co-chairman for the active contribution. I thank the audience for their numerous presence on this Friday morning. And I wish you a good day and today or tomorrow, safe trip back home. And see you all in Las Vegas next year. Thank you.